Okay, so picture your liver. It's like this incredible, super busy chemical factory inside your body running 24/7. It's processing everything you eat, detoxing waste, you name it. But what happens when that factory gets completely overwhelmed? Not with chemicals, but with fat. Well, today we're going to put on our biochemical detective hats to crack the case of hepatic steatosis, or as you probably know it, fatty liver. So let's open up the case file and see what we're going to cover. All right, here's our game plan. First, we're going to define the problem. What exactly is going on? Then, we'll identify our two main culprits. After that, we are diving deep into the biochemical crime scene itself. Then, we'll learn how to spot the evidence in the clinic. And finally, we'll talk about how to actually reverse the damage. Sound good? Let's jump in. First up, we've got to get a handle on what we're actually dealing with here. Just think of it as a major factory malfunction, where the storage rooms are literally overflowing with stuff that shouldn't be there. So what is actually happening when this goes down? You see, your liver is designed to be a processing plant, right? A dynamic hub of activity. It was never meant to be a passive warehouse. And when that fundamental role gets flipped on its head, well, that's where all the trouble begins. And here we have it, the official diagnosis: hepatic steatosis. It's just the technical term for when you get an excessive buildup of triacylglycerols. That's the main type of fat your body uses for storage inside the liver's main workers, the hepatocytes. Put simply, it's a whole lot of fat piling up where it really doesn't belong. Now, what does excessive actually mean? Let's put a number on it. A healthy liver has less than 5% fat by weight. But once you're in fatty liver territory, that number jumps up to over 5, sometimes over 10%. And that's not just a tiny change, it's a massive shift in the liver's entire metabolic environment. Okay, so we know what the problem is. Now it's time to line up our two main suspects. Because, what's causing all this fat to build up? That completely changes the nature of the case. So on one hand, we've got alcoholic fatty liver disease, or AFLD. As the name suggests, it's caused directly by chronic alcohol use. The good news here? It's often totally reversible if the person stops drinking. But on the other hand, we have the one we're seeing more and more of, non-alcoholic fatty liver disease, or NAFLD. This one is tied to metabolic syndrome, things like obesity, type 2 diabetes, high cholesterol. And the real danger with this one is that it can quietly progress to some really serious liver damage without anyone noticing. This right here is probably the most important concept to nail down for NAFLD. It isn't just about fat sitting in the liver. It's a direct symptom of a body-wide metabolic problem. Once you get that, connecting it to all these modern lifestyle diseases becomes so much clearer. Okay, now it's time to pull out the microscope. We're zooming way in on the crime scene, the individual liver cell, the hepatocyte, to figure out the 4 key ways its internal machinery can break down and lead to all this fat piling up. Now, to make this super easy to remember, we're going to stick with our factory analogy. First, way too many raw materials are getting delivered to the factory door. Second, the factory's own assembly lines just go into crazy overdrive. Third, the furnaces that are supposed to burn off any excess material, well, they stop working. And fourth, the shipping department just shuts down, trapping the finished product inside. So, breakdown number 1, the factory gates are just flooded. When someone is obese, their fat tissue all over their body releases this huge wave of free fatty acids into the blood, and guess where they all end up? The liver. At the same time, with chronic alcohol use, you mess up the liver's internal chemistry. Specifically, you throw off the NADH to NAD+ ratio. This makes the liver way less efficient at dealing with the fats that are already there. Okay, breakdown number 2. The problem isn't just what's coming in from the outside. The factory itself starts making way too much product on its own. See, in metabolic syndrome, you often have high insulin levels, which is like a manager just screaming, make more, make more. This stimulates key enzymes that take extra carbs from your diet and turn them into brand new fatty acids, right there inside the liver. This process is called de novo lipogenesis, literally making new fat, and it just pours gasoline on the fire. Breakdown number 3. The incinerators are busted. The mitochondria inside your liver cells are supposed to be burning fatty acids for energy. That process is called beta oxidation. But both that high NADH from alcohol and the insulin resistance we see in metabolic syndrome can jam up the works. So the fat just sits there, piling up, instead of being used for fuel. And our final breakdown, the shipping department is closed for business. A huge part of the liver's job is to package up excess fat into these little particles called VLDLs and ship them out to the rest of the body.
But to build these VLDL packages, it needs specific proteins called apolipoproteins. Think of them like the cardboard boxes. If you can't make enough of those proteins, you can't build the packages, and the fat gets trapped right inside the liver cell.
So we have totally nailed the biochemistry, but how do we actually spot this in a patient? This is where it gets really tricky, because there's a good reason they call fatty liver a silent disease. And this is the crucial point. Most patients feel completely fine, especially in the early stages. They are totally asymptomatic. The very first clues might be an enlarged liver, or hepatomegaly, that a doctor finds during a physical exam, or maybe some slightly elevated liver enzymes on a routine blood test. Sometimes a patient might complain about being tired, but it's really vague. More often than not, it's just found by accident. And this is exactly why finding it early is so critical. This shows the dangerous path that untreated NAFLD can take you down. It starts with simple fat accumulation, but that can progress to something called NASH. That's non-alcoholic steatohepatitis, which is when inflammation and damage start to kick in. From there, you can get scarring or fibrosis, and that can lead to cirrhosis, which is severe, irreversible scarring that can end in total liver failure. Now for the part that really matters in the clinic. What can we do about it? How do we intervene? Let's take a look at the risk factors and the management plan to get this factory back up and running properly. Okay, for all of you studying for exams, you are going to love this. There's a perfect mnemonic for the main risk factors for NAFLD, and it spells out fats. F is for fat, as in obesity. A is for altered glucose, like in type 2 diabetes. T is for high triglycerides, and S is for a sedentary lifestyle. It perfectly nails the metabolic nature of this disease. So the treatment plan makes perfect sense when you look at those risk factors. The absolute #1 cornerstone is lifestyle modification. Weight loss, diet, exercise, that is the single most effective thing a patient can do. After that, it's all about getting those other metabolic issues under control. And of course, for AFLD, it's simple, complete abstinence from alcohol. It's non-negotiable. All right, detectives, let's wrap this case up. We'll do a final report summarizing the key evidence and then a super quick quiz to make sure all this information really sticks. So here are the high-yield facts you have to remember. Fatty liver is all about too much triacylglycerol storage in the liver cells. The two main causes are alcohol and metabolic syndrome. This happens because of those 4 breakdowns. More fat coming in, more fat being made, less fat being burned, and less fat being shipped out. And the fix? It all comes down to lifestyle and managing those risk factors. Time for a pop quiz. So, what's that primary biochemical problem in alcoholic fatty liver? Come on, you know this one. It's that increased NADH to NAD plus ratio. That ratio directly messes up beta oxidation, which is the burning of fatty acids. It's a direct biochemical consequence of how the liver processes alcohol. And I'm going to leave you with one last thing to think about. We've seen just how tightly NAFLD is linked to obesity, diabetes, and our whole modern way of life. So as these conditions become more and more common all over the world, are we looking at a silent epidemic of liver disease that's about to become a very, very loud global health crisis? That's something for all of us in medicine to seriously consider.